Hi, I'm Dr. David Greene with PreferredPainCenter.com. Today the topic of conversation is sacroiliac joint pain. The SI joint, as it is known in layman's terms, looks like this. So you have the lowest level of the lumbar spine, which is L5, connecting with the sacrum, which is pretty much in a triangular type of a shape. But the joints are on either side of the sacrum where it connects with the pelvis. This bone is called the ilium, this bone is called the ilium, hence sacroiliac joint, all right? These joints have cartilage just like any other joints in the body, hip, knee, whatnot, but they have much less movement. But the point there is that they have movement. So arthritis plus movement equals potential pain. So when you have that type of pain, what do you do about it? Unfortunately, it's very prominent in the US as SI joint pain. So the first treatment, which is easy, is over-the-counter things like Tylenol or anti-inflammatories. Make sure to stick to the manufacturer's dosing, otherwise you can have a problem with kidney or liver. Most of the time pain goes up like on a bell curve and then comes back down, but the question is, what happens if it goes up and just stays there? Is that something you just have to live with? The answer is no. There are multiple other treatments that can help tremendously. The first one would be physical therapy. That can help dramatically, or a short-term dosing of narcotics. Now, not enough to like get addicted, or I'm not talking about for months, I'm just talking about for a few days to a week, just to keep things on an even keel so that you can function and wait for hopefully the bell curve pain, pain to come back down, all right? Now, chiropractic treatment can also help tremendously, but what happens after that, all right? What if that's just not quite cutting it, so to speak? That's where interventional pain management treatment can make the world of difference. So let's look at that for a second. Basically what you have is a skinny joint, all right? It's not a big fat joint like the knee. It's pretty easy to get into, right? So you have a skinny joint and it's fairly irregular. So if you see it on a bone model, it actually looks like it might be pretty easy to get into. It's not. That's why it's very important that a physician use a fluoroscopy, which is a real-time x-ray machine, to get into this joint, because there's weird angles involved. If you have arthritis, you have bony overgrowth, okay? So it may overlap the entrance to it. It can be tough to get in there. Now, do you want to take a day off from work or two, go in for a procedure, wait there for a while, get the procedure done, and then have them miss? All right? So that's why it's very important to have a fluoroscopic machine involved and a pain doctor who knows what he or she is doing. All right? You shouldn't have this done in the office with no x-ray machine. The miss rate is going to be well over 50%. Okay? So a steroid injection with numbing medicine can really help in this joint. And it may need to be repeated because it's a long joint. And if you inject medicine down low, it may not get up here. So maybe the doctor needs to do injection at 2 separate areas or on successive weeks. It can make all the difference to do that. And it may be necessary to have an injection on both sides, depending on which side is painful on physical exam and whatnot. Now, what if that works and it wears off? What are you supposed to do after that? There's an answer, okay? Now, more and more physicians are able to do what's called a radio frequency ablation of the SI joint. Every joint has sensation to it, okay? If you don't have sensation to a joint, it can turn into what's called a Charcot joint, and that's common in poorly controlled diabetics, where you don't feel any sensation to a joint. So it doesn't have any pain, and that can be very destructive. Pain in some aspects is good. It helps you, from doing things that are inappropriate. So, but the key is, if you can deaden the little tiny nerve endings that bring sensation into this joint, just like you would in the facet joints up higher, that can give pain relief for months to a year, okay? So what a pain doctor can do is, under the x-ray machine again, and proper numbing and maybe some IV sedation, is they put a catheter in this area, little tiny, looks like a needle, and then they can heat up the area around the joint to 80 degrees Celsius or so, and that can deaden the tiny little nerve endings that are providing sensation and hence pain from the joint. And that can give pain relief for months to well over a year. The latest study last year that was done looking at facet radio frequency ablation up in the lumbar spine showed the average pain relief was 472 days. Very impressive. So anyway, there you have an overview. The preferred pain center in Arizona for pain relief is Arizona Pain Specialists. Call the number you see on the screen, 602-507-6550. They have chiropractic, physical rehab, pain doctors who do medication management, double board certified. You will not find a better pain clinic in the state of Arizona. Multiple locations and minimal downtime with getting you in to be seen. I'm Dr. David Greene, preferredpaincenter.com. Your pain stops here.